Dr. Hockman.
Hi.
Thanks for coming back.
Yep, it's good to be back.
So back by popular demand, right?
That's what I hear.
Yes. We've been doing a little bit of reading, and there seems to be a lot of buzz around facelifts right now. Buzz in Town and Country, Vogue, and other trending popular magazines. So I was going to share a few things that we found and see what you thought.
Okay.
Vogue and Town and Country said most patients who opt for facelift treatments are in their 40s to early 60s.
I think 40s is on the low end. I think that's really kind of early. Maybe you start seeing some very early changes that then in your 50s, 60s, 70s, get accentuated. But a facelift, if that's what the quote is about, there are very few 40-year-olds that I've seen in my career who are true candidates for a facelift.
Town and Country lists drooping of the brows and facial wrinkling as some of the skin concerns for which a facelift is an ideal treatment.
So a facelift addresses the lower third of the face and the neck. The brow is nowhere near that, so a facelift would have zero effect on the brow.
So false to drooping brows and facial wrinkling.
Town and Country.
Next one. Town and Country interviewed a surgeon who said, when you want to completely change your facial structure, facelift is the way to go.
Totally false. Nothing that we do in facial plastic surgery, or honestly in plastic surgery, the goal is not to draw attention to something, but to draw attention away from something. So changing the structure of a face to me sounds like exactly what you don't want to do. So
thumbs down.
Thumbs down with Town and Country again.
Both magazines, Vogue and Town and Country, shared that the best results come with a combination of different types of techniques that are individualized to each patient, not a cookie cutter approach.
Totally agree. Yeah. So again, a procedure, whether it's a facelift or rhinoplasty, whatever procedure, you can pick whatever operation you want, that operation needs to be tailored to the patient. So I could say I'm doing a facelift in these 3 different people, and they're totally different operations for each one of them. One of them may need liposuction, one of them may have a lot of extra skin. But they're still a facelift. And the same thing you can say for any procedure, really. So that is where the differences are. It's not the name of the procedure, but what actually happens that addresses the needs of that particular patient.
Vogue shared that a good facelift would last 10 to 15 years. Is that accurate?
No. So if we took a picture today of you and me, and we took a picture in 6 months, 9 months, a year, 2 years, 5 years, we both would be changing, right? If we took a picture today and did a facelift or whatever procedure, and then took a picture at those same time intervals, we both would still be changing. Now that patient is starting off from a better place, right? But if somebody's website says Dr. So-and-so's facelifts last 5 years, 10 years, whatever you want, what does that mean? That on the 5th anniversary, the whole thing drops? That's not what happened, right? I mean, it's slowly changing. So there's really no way to put a time period on it.
Well, thank you. Thank you very much for clearing that up for our readers.
My pleasure.